Good afternoon. I'm Scott Harrah, Director of Digital Content in the UMHS North American Administrative Office in New York City. And we're speaking today with Dr. Michelle Hornedo, who mastered in internal medicine and is a class of 2022 graduate. And Dr. Hornedo, good afternoon and welcome today.
Hi,
Can
good
you,
afternoon. Thank you
good
for having me.
afternoon. Can you tell us a little bit about where you're doing residency and also a little bit about yourself and where you're originally from?
Yes, well, I'm actually was born and raised in San Juan, Puerto Rico, where I've lived all my life up until my undergrad, which was in Penn State Behrend. And I've been fortunate enough to have an amazing family support. Obviously, being from the Latin community, we're all very warm and welcoming, and it's part of what I want to bring into as becoming a physician and being that way with my patients. So, and also just excited that I matched in Ohio Health Riverside Methodist Hospital in Columbus, Ohio, in internal medicine.
Awesome. And did you always want to be a doctor? I mean, what was your undergraduate background in?
Well, my undergraduate background was in Bachelor's of Science in Penn State Behrend. I did always want to become a doctor. I think even growing up, my parents always say that that's what I would always mention, how they ask little kids in kindergarten, what do you want to become? And I would always say I wanted to become a doctor. And I remember trying to play with the first aid kit, which wasn't an appropriate toy for a kindergartner. So my parents would actually get me some toy stethoscopes. It's a long process, obviously, that we've all gone through, but it's been amazing.
Okay, great. And what made you decide on attending UMHS over other med schools?
Well, UMHS was very familiar, and everybody was so warm and welcoming. And like I said, it's part of how I was raised and my whole environment being from Puerto Rico. So I think that whenever I was in the interview, that really came across. And not only that, I had a really close friend from college, actually, which I talked to prior to making my official decision. And I remember we had a FaceTime call, and I would just ask him all of these questions. And everything that he told me was just about how much the professors had an open door policy, how everybody was so willing to help you out through those topics that you were having some trouble with. So I knew it was an environment that I was going to thrive in the long run. So yeah, that and the fact that I know for now graduating, I know that they have different, or UMHS has so many great opportunities in different hospitals, and you get to meet so many doctors and physicians that teach you so much from different perspectives. So I think that's one of the main reasons.
Sure, and that's awesome. And I know that there's a large community of students from Puerto Rico in St. Kitts. And you mentioned St. Kitts. Were there any professors or any staff members, either in St. Kitts or Maine, that you found especially helpful or inspiring during your medical education at UMHS?
Yeah, well, I can definitely think of various people that were helpful and inspiring, but I can say that Dr. Doherty, may he rest in peace,
Yes.
was such an amazing doctor and I mean teacher and also just person, because I remember even just going to his office just to chat with him, even with my best friend Gloria Marvina. We were there all the time, even just talking about the specific topics that we were having some troubles with. So, and one of the things that I really liked about him was the fact that he really believed in me as a student, and he helped me grow and inspired me in that way. And someone else that I can mention is Jonathan Timon. He was amazing through the long process of an application. It's such a stressful moment
Right.
for us as students. So obviously having that support from him and him being so believing in me as well as a student and everything that I've accomplished was, I cannot speak the words. It's been amazing. And also, obviously Patrick McCormick, he's also amazing in that process. So
Great, and I know
those
them
are
both very
some of
well.
the.
Jonathan and Patrick work in the New York office with me,
Oh
and
yeah.
I did know Dr. Doherty as well, and may he rest in peace, like you said.
Yeah.
Tell us, is there anything specific about your medical education that helped you match in internal medicine that you can think of offhand?
I think there's so many aspects in UMHS that have really helped out through this process. And I think one of the main things, like I mentioned, we have so many opportunities to be in different hospitals throughout our clinical rotations. And you don't realize this until you're there, but everybody has a different perspective on a specific topic that you personally might be having some trouble with. So I remember that there's some like the attendings giving me certain tricks of how to understand it in the long run. And I'm going to have that whenever I'm a resident, whenever I'm an attending, that's what I'm going to be thinking of and what I'm going to be remembering. So I think that just being able to go to the different hospitals, learn from different physicians, I think is one of the main things that has really helped me go into internal medicine and match.
Okay, and tell us a little bit about your upcoming internal medicine residency, about the hospital that you're matched at.
Yeah, so Ohio Health Riverside Methodist Hospital is has got the internal medicine program. It's a hybrid between an academic and a community-based hospital. Oh, excuse me. And they have such an amazing opportunities, like with different electives. They really prepared their residents with the didactics of the ABIM exam. And I really was drawn to them, not only because of everything in their curriculum that they offered to the residents, but also the fact that during the interview, like I said, in UMHS, and one of the things that really drew me to them was the fact that they were very warm and welcoming, and they were very open to talking about all of the topics and the things that they were willing to bring to the table when it comes to the residents and what they teach.
Okay, and why did you want to do a residency in internal medicine? And could you maybe explain a little bit about what internal medicine is for those who may not be familiar with it?
Yeah, so one of the main things that drew me into internal medicine was the fact that as an internal medicine physician, you're able to see in a day-to-day life all kinds of different conditions and illnesses that I personally needed for my as becoming a physician. It's one of the things that if I see one specific topic, I can see it in various days. Like for example, you go from cardio to gastrointestinal to neurological, you can see all of these different things every day on a day-to-day basis. So an internal medicine physician is equipped with diagnosing them, creating a treatment plan for all of these illnesses. And you can also go into a subspecialty. You can do the hospitalist route. You could do a primary care physician. So the opportunities are really limitless because you can look at if you want to specialize into a specific, let's say cardiology, like I mentioned, you can. So it's something that drew me to it because the options are limitless, like I said.
Okay, and what interests you the most really about internal medicine?
Well, the one of the things that really interests me is that I need to be able to see a little bit of everything every day. There's
Sure.
not one specific organ system that I can say I can live with the rest of my life just talking about cardiology. I want to be able to
Yeah.
just see everything every day. And that's one of the main reasons I chose internal medicine. And also the fact that as an internal medicine physician, you work with so many different doctors from like I said, neurology, nephrology, and that teamwork is one of the things that I want to incorporate into my future as a career and as a physician. So that's another thing that really drew me into internal medicine.
Okay, great. And you mentioned our wonderful academic affairs department, Patrick McCormick and Jonathan Timon, but they really, can help a lot with advice on matching. But do you have any advice that you can think of offhand for current or incoming students about attending UMHS who are about to enter the match process?
Yeah, well, I could think of many advice that I could give to the upcoming students, but one of the things that, well, a couple things. I say create your own study technique. I
Right.
know that USMLEs is a very stressful time. It's very um, scary to say the
Right.
least. So it's definitely something that you're going to hear a lot of opinions and resources from a lot of many different people. So just make sure that you choose the resources that work for you, create your own study habits, your own study techniques to accomplish that goal. And also just work very hard into your clinical rotations because that is the moment where the attendings are going to see what kind of resident you're going to become. So work hard and show them what you can do on a day-to-day basis, that you know your material, that you are willing to put the foot forward into working hard.
Okay, great. That's excellent advice. And let's also just segue a bit and talk a bit about the COVID-19 pandemic. And I think everybody has an experience over the
Yeah.
past few years. It's so unprecedented. Do you feel that this is a crucial time to be a doctor and that the public has a better understanding of the importance of doctors after what we've all gone through globally the past couple of years?
Yeah, I mean, the COVID-19 pandemic really brought to light a lot of the day-to-day things that physicians have gone through and all of the sacrifices that we've put forth to be able to be where we are. So I do think that it has been a crucial time and that it has been shown to the public. One of the things that I can say for a fact is that for me, my COVID-19 pandemic experience was being working in the National Guard task force in Puerto Rico and being able to see how much the physicians, the medical students, and even soldiers from the National Guard were all willing to put their lives at risk to be able to help the public and the population here in Puerto Rico. So it's not just the physicians that are important. I think that the healthcare system in general, there's so many people that play an integral part into helping the patients, helping the people and with COVID-19, and also the patient, because they have to, whenever we make the treatment plan, they're the ones that have to go through with it. So it's all about working together to accomplish the goal.
Wow, and I know with Hurricane Maria, Puerto Rico has been through a lot the last few
Yeah.
years. So, and this pandemic, it just, I'm sure, was not any better. But what is the one positive thing that you think that you've coming out of this whole experience with the pandemic in Puerto Rico in particular that you could talk about, perhaps?
Well, one of the positive things I think is that we've learned from, you know, obviously we're, like I said, we're a very warm and welcoming environment. We've learned how to change that in order to help and our health when it comes to COVID-19. But I think one of the positives is just the fact that we value our family. And it's one of the moments where it really makes you think, like, I want to do this and I want to protect my family against COVID-19 and other people. Obviously, we're still warm and welcoming. That hasn't changed. It's part of our culture. So yeah, it's just about valuing more than we did before our
Yeah.
members. Yeah.
Absolutely. And you really were kind of one of the leaders in the Caribbean, because I know in some of the other Caribbean islands, there was a lot of vaccine hesitancy, but I know in Puerto Rico, you guys did an amazing job of just getting the word out about the vaccines and helping people, during the worst of times.
Yeah, we've been lucky that everybody's been able to get vaccinated. I think we're able to say that we've got one of the highest rates when it comes to
Yeah.
vaccinations. So it's helpful in that regard. There's still obviously people out there that need to know the importance of vaccinations, and but at least here in Puerto Rico, we've been very good at getting to that goal.
Yeah, you have, absolutely. And what do you think most med students have learned from the circumstances of the pandemic as we move closer now to the goal of everybody being vaccinated?
Yeah, I think for med students, we've learned the mechanisms, we've learned how vaccines are manufactured. But now with the COVID-19 pandemic, we've seen the crucial conversations that we have to have with the patients of how important the vaccines are and how they work, and explain to them what are the importances in regards to the consequences, meaning that it's going to be safer for us as healthcare workers, for the people around you, for your family members. So now, as medical students, we can say, okay, we've seen this and we've been able to experience it firsthand that maybe before we weren't as exposed to compared to now. So
Right.
it's good that we're able to actually say, okay, I know how to have this conversation with my patients.
Okay. And is there anything else that you would like to add that we haven't mentioned today about just being a med student at UMH in general, or your thoughts on going into residency, or just, words of advice you'd like to give to the current and prospective students out there?
Just enjoy the ride of being as a medical student. It goes by so fast. There's so many different opportunities that are going to be given to you as a UMHS student. So definitely take advantage of all of it because in the long run, you're going to learn and also it's going to help you for the match and which is the goal.
Of course, yeah. Also, are you, Dr. Ornado, are you open to having students contact you via email if they have any questions? And I know we have a huge Puerto Rican community at UMHS that they might have some questions. Are you open to, I know you're going to be very busy with residency, but if
Yeah.
students want to reach out to you via email,
Yeah, I have no problem with students reaching out to me. If any questions are there, like I'm willing to help out anybody in that area.
okay, great. All right, and we'll provide that information for everyone. Anything else?
Yeah, that'd be
Okay, Dr. Ornado, I thank you so much for your time. And today you've been a wonderful interview, and I wish you all the success and best of luck in your upcoming residency.
thank you
Okay?
so
All
much.
right, have a great afternoon.
You too.
Okay, all right, take care.